Guys, can we pause the game for a second? My stomach hurts really, really bad.
Ow, my stomach hurts.
Ow, it hurts so bad.
Audrey, I have to go to the bathroom.
It'll be a minute.
I think she has Crohn's disease.
What is Crohn's disease?
Crohn's disease is an inflammatory bowel disease. This is chronic inflammation that causes ulcers and open sores in your bowels. This can lead to pain and bleeding. Inflammation affects the body's ability to absorb nutrients properly. This can cause fluid and electrolyte imbalance. Crohn's disease mainly affects the end of the small intestine and the beginning of the large intestine, but can occur anywhere in the GI tract. The bowel wall scars becomes thicker, narrowing the intestines, making it harder for food and nutrients to pass through. Crohn's disease can cause ulcers, which can lead to peritonitis, which is when there's stool leaked into your abdominal cavity and it causes infection of your peritoneum.
Risk factors include genetic and family history. If you have a relative who has Crohn's disease, you are more likely to get it, as well as NOD2. Environmental factors like geographic locations in Western countries. Smoking also is an increased modifiable risk factor. Increases flare-ups and complications with surgery. High diets with processed food, sugars, and diets, as well as low fiber intake and sedentary lifestyles. Microbial imbalances disrupts in gut bacteria. Immune system responses like overacting or misfiring of the immune system. Age is often diagnosed between 15 and 35 years old, and males are more at risk. History of infections or antibiotic use increases by early use of childhood and may disrupt normal gut bacteria and increase flare-ups.
Audrey, here's a nice fact. What are your clinical manifestations?
Fever, abdominal pain, cramping, nausea, vomiting, diarrhea, mouth sores, weight loss and anorexia, and eventually colon cancer. Wait, hold on. Let me explain. Crohn's disease increases the risk of colon cancer because of the chronic inflammation in the colon. The inflammation in the colon triggers the cells to rapidly turn over, which can then lead to genetic mutations. Taking preventative measures for Crohn's disease is very important. Colonoscopy should be done every 1 to 3 years for people with Crohn's disease to screen for precancerous polyps. Vitamin deficiencies and inflammation can lead to mouth sores and osteoporosis. People with Crohn's disease are more at risk for kidney stones because of malabsorption in the small intestine and dehydration.
Now a word from our sponsor.
I have moderate to severe Crohn's disease. Now there's Skyrizi.
Things are looking up, I've got symptom relief. Control of my Crohn's means everything to me. Control is everything to me.
Feel significant symptom relief with Skyrizi, including less abdominal pain and fewer bowel movements at 4 weeks. The majority of people on Skyrizi achieve long-lasting remission at 1 year.
Serious allergic reactions and an increased risk of infection or a lower ability to fight them may occur. Tell your doctor if you have an infection or symptoms, had a vaccine, or plan to. Liver problems may occur in Crohn's disease.
Ask your gastroenterologist how you can take control of your Crohn's with Skyrizi.
As a nurse for a patient with Crohn's disease, it's important to get a detailed health history and to confirm their medication regimen at home. You want to do a good abdominal assessment on the patient because they can present with abdominal distension, hyperactive bowel sounds, and just overall just pain and cramping. They may present with an intermittent fever, a high heart rate, and hypotension. Their skin will most likely be pale, and they'll have poor skin turgor and dry mucous membranes from dehydration from going to the bathroom so much. Some nursing interventions are daily weight, strict I's and O's, monitoring labs, controlling their pain, making sure they are compliant with their medications, and monitoring the frequency and amount of stools.
Some main complications of Crohn's disease includes ulcers, which can lead to a bowel perforation, causing bowel contents to leak into the peritoneal cavity, then causing peritonitis. A patient with peritonitis would present with nausea, abdominal tenderness, and severe abdominal pain. Another complication of Crohn's disease is fistulas. A fistula is a tunnel-like passageway in your body that connects two different areas of the body that shouldn't be connected. An example would be your colon connected to your bladder. A patient with Crohn's disease would present anorexic or malnourished due to their bowel wall scarring and becoming thicker and their intestines becoming narrower, not allowing nutrition to be absorbed.
Here we have a chart of important lab tests with Crohn's disease. We have the normal column in the middle and then the Crohn's disease values over on the right. Some significant labs to watch for in patients with Crohn's are the white blood cell count, because the nurse needs to monitor for infection, because this could be something severe like peritonitis or sepsis. Hemoglobin and hematocrit are also super important values because the patient is most likely losing blood in their stool, so these values would be decreased. AST and ALT are liver enzymes, and they're typically elevated in patients with Crohn's because of the malnutrition and the possibility of the patient developing fatty liver disease. ESR is a really telling factor of inflammation in patients. It shows chronic inflammation, so this would be increased. All of the patient's serum electrolyte levels would be decreased because of the extreme fluid loss with diarrhea and just overall the malabsorption from Crohn's disease. So this is where the kidney stones and the osteoporosis come in as possible complications from Crohn's.
Some endoscopic procedures that can be done is a colonoscopy and a sigmoidoscopy, and a CT and an MRI can also show inflammation in patients with Crohn's.
Come with me to treat my patient. Can you confirm your name and date of birth for me? Any allergies?
I'm giving corticosteroids to treat inflammation. What are you doing?
I'm doing surgery. I'm performing a strictoplasty, which opens narrowed areas that are obstructing the bowel.
Aminosalicylates decrease inflammation in the lining of the GI tract.
Examples include sulfasalazine, mesalamine, osalazine, and balsalazide.
Antimicrobials reduce inflammation, restore the balance of gut bacteria, and decrease complications.
Cipro and Flagyl are commonly prescribed to treat complications like abscesses and fistulas. Xifaxan can treat diarrhea and help maintain remission in patients.
Corticosteroids suppress the entire immune response.
Prednisone is most common but can have some nasty side effects such as weight gain, acne, mood changes, and terrible wound healing.
Immunosuppressants reduce the activity of the immune system, decrease inflammation, and damage to the intestines. Biologic and targeted therapy, immunomodulators, reduce inflammation and potentially heal the damaged intestine by targeting specific parts of the body's immune system or inflammatory pathways.
Humira is an example of an immunomodulator, but it can also have some terrible side effects.
Salmon and tuna are rich in omega-3 fatty acids, which have anti-inflammatory properties and reduce inflammation in the digestive tract. Fruits and vegetables have a nutrient-rich composition including fiber, vitamins, and minerals, which support gut health and are easier to digest. Cooked and cooled or reheated starches increase the amount of resistant starch. Resistant starch is a type of starch that resists digestion in the small intestine and ferments in the large intestine, providing fuel and beneficial gut bacteria. Other helpful tips include staying hydrated, preparing meals in advance, keeping your kitchen stocked with foods you know won't aggravate your stomach, boil, grill, roast, and steam instead of frying foods, review the menus of restaurants ahead of time, and lastly, bring your own meals to family gatherings or holidays. What factor is considered modifiable and contributes significantly to both the development and worsening of Crohn's disease? A. Genetic predisposition. B. Age of onset. C. Smoking. D. Family history. The answer is C. Smoking. Smoking is the most significant modifiable risk factor. It increases the severity and risk of relapse.
You are providing teaching to a patient with Crohn's disease who is newly diagnosed. Which statement by the patient requires re-education? A. There is no cure for Crohn's disease. B. I will need to eat a high saturated fat and low fiber diet. C. I will need to get regular colonoscopies to screen for precancerous polyps. And D. Ulcers and fistulas are complications of Crohn's disease. The answer is C. You should eat a high calorie, high protein, and high vitamin diet, and you should avoid foods with saturated fats.
Question number 3. A client with severe Crohn's disease has just had surgery to create an ileostomy. The nurse assesses the client in the immediate postoperative period for which most frequent complication? A. Folate deficiency. B. Malabsorption of fat. C. Intestinal obstruction. Or D. Fluid and electrolyte imbalance. The answer is D. A common complication of Crohn's disease and ileostomies is electrolyte imbalance. The patient requires constant monitoring of intake and output to prevent this from occurring.
The patient with Crohn's disease is complaining of abdominal pain, diarrhea, and unintended weight loss. The lab values are as follows. Which of the following nursing actions is most appropriate? A. Initiate fall precautions due to anemia and fatigue. B. Educate the patient to increase their protein intake to increase their albumin. C. Notify the provider about signs of possible inflammation and infection. And D. Redraw the labs. The answer is C. An elevated ESR and white blood cell indicate inflammation and infection, which are common during Crohn's flare-ups. Other answers may be appropriate, but this one is of the highest priority. The provider must be aware of these values to assess for further medical treatment or intervention.
Audrey, be so serious.
Oh my god. We're gonna have a whole video of us playing this actual game.
No, like,
Wait.
my stomach just...
I don't know where to go.
Do I need to talk about fistulas?
An apoplectic. App and ectomy, right?
Appendectomy. Appendectomy. No. Appendectomy.
Appendectomy. Appendectomy.
Audrey, here's an ice pack. What are your clinical manners?
Okay, I think I'm done.